Every day, schools are working hard to create inclusive school communities where all students can grow in knowledge and values and achieve their potential. But the mental health challenges some students face may make this difficult. Mental health problems are real. They include depression, anxiety, and bipolar disorder. 1 in 5 children and youth will experience a mental health challenge, and in Toronto, that adds up to 500,000 children. We know that students with a psychiatric disorder miss 40% more school days, and 25% of these students will drop out of school completely. The good news is, community mental health and addiction nurses can help. Our specialized nurses work with students, their families, and schools to ensure that the students get the assistance they need to address mild to complex mental health or substance abuse issues. Care in Toronto is available in English and French. Mental health and addiction nurses help students transition back to school from psychiatric treatment facilities, hospitals, justice, and related programs. The nurses help students and their families access and understand the healthcare system and local resources that are available, like community mental health and addiction services, emergency support, and primary health care. The nurses can teach good mental health and resiliency skills for the general student population and build awareness among educators about mental health and addiction. Our staff are experienced mental health nurses. Many have worked in psychiatric hospitals or within the justice system. They've joined our team because they want to provide early intervention to prevent youth from falling into crisis. This program is funded by 3 Ontario ministries: Health and Long-Term Care, Education, and Children and Youth Services. That means our nurses are seen as, and are, neutral supports to both students and schools. To receive mental health and addiction nursing support in Toronto, students must be referred by a publicly funded school or a hospital. Our program is completely voluntary, and students can withdraw at any time. They must actively participate in planning, goal setting, and treatment. Consent from the student's parent is required. Nurses usually work with their clients for 1 or 2 months, meeting them at school in most cases, or at home, or another location if needed. Nurses will listen to the student and family members, answer questions, develop a care plan, liaise with other healthcare providers and community agencies, and help with strategies for managing emotions, thoughts, and behaviors. Nurses communicate with the school in order to keep their clients safe and help educators understand how to help the student at school. The student decides what to share and what remains private. Before leaving the program, nurses connect each student with appropriate community resources so they can access ongoing support. Across Ontario, community mental health and addiction nurses have made a difference to thousands of students and their families and schools. We want to work with you today.